Well, we are the stroke unit. This stroke unit is part of the Comprehensive Stroke Center. We have the recognition of with an award that is a European Stroke Organization give us a stroke recognition of the Comprehensive Stroke Center. In here we treat and diagnose patients with a stroke. The patient arrives in emergency, comes to downs here in emergency, start the treatment and get up to this floor is a stroke unit. When the patient was admitted, treated with their doctors, with a nurse. And in this hospital is very important because it's part of the beach area, a huge area of the South Metropolitan area of Barcelona. And we are connected with several community hospitals. Networks by telestroke or another ways of communication is important to transfer the patient with the stroke that happens in this center. And transfer it comes here in this hospital, they continue the streamline of the process of the treatment. Well, whether students come here is very important to start in our brief sessions in the morning, where we review all the patients who were admitted in the hospital. Then we come here in the stroke unit, we pass visit with the doctors, with the nurse. John is very important to the communication with the doctors, the nurse, to check the vital signs, the treatments. You can go and pass with visit with a rehabilitation therapist, occupational therapist, so nutritionist, dietist, because it's important to know how the stroke team works in the hospital to find any gaps or any situation you can take any part of improvement in this process. It's important to see all our work, the work that do the doctors, the nurse, the therapy occupationalists, dietists, hematologists, neurosurgeons. You have the opportunity 1 or 2 days to go to the surgical room and to know how it works and all the interventions we perform in this hospital. It's a huge hospital, a complex hospital. There are many interventions, complex interventions about the brain, about the neurosurgery. And so it's important to know how it works in emergency. You can go on the first floor in emergency with the doctor is on duty and receive the patients in emergency with the ambulance and see what happens there. And all the treatments and diagnosis happens in emergency. It's important the first part of it before the patient arrives here in the stroke unit. Well, there are several opportunities to find several gaps. Problems can resolve the communication between doctors and nurse. So the radiologists, the image, we treat patients, but so they are associated with a radiologist image, the stroke, hemorrhage or infarct. It's important to know very well what is the result of this image and the export of this image to another database. This is important how to work. The new artificial intelligence can aid us to improve the diagnosis and accurate the treatments according to these results. Yes, of course, there are many problems, but I think it's very difficult for a doctor to stay in all times and all the places to identify this problem. It's a good opportunity for you, the students, to stay here with the doctors, with the nurse, with several other part of the stroke team, and identify these problems. It's probably the minor problem for me, but it's important for the patient. Imagine the problem with the meals arrive in a tray, and the tray and the meal arrive late and is chilled or is frozen, the meal. How we resolve this? Or patient with an impairment in the right side, on the left side, in the movement, the arm, on the leg. How can we improve this movement? With rehabilitation, with new technologies, with new and other devices. Devices can improve the diagnosis of a stroke, for example, by analyze the rhythm, the heart rhythm. More than a stroke unit we have now the usual monitorization, the electrocardiography. The importance is not focusing on an idea and the work that we do in the doctors every day, when we are exploring the patient, examine around the room. The room of the patient, the bed of the patient, the room is important to check all the environment, and you will find several solutions or problems you can resolve it. This is very important, and enjoy doing this with taking part in our stroke team.